Hello out there. This is going to be part 5 of my Morton's neuroma recovery series. So it's December 22nd. This is roughly 10 months after my surgery, so I'm going on 11 months almost. And it's been a while since I've made a video about Morton's neuroma and where I am today. So I thought I'd make a video there and give folks an update on things and how it is today. And I think I'll start with, what was it like going back to work? So I took 4 weeks off from the date that I had the surgery till I went back to work. And the first day I went back to work, with a surgical shoe on the foot that had surgery on it. Not a boot, but just a shoe, a flat shoe with Velcro on it. And kind of hobbled around and basically got through the day, and not too many problems that first day. Second day, same thing. Not too bad. I thought I was, on the right path and all that. Third day, big problems. I had enormous insomnia. It was so very bad. I don't think I slept a single minute. I think it's a combination of things. For example, I spent an entire month post-surgery not doing next to any physical activity because you're trying to heal, you're trying to get better. So you're resting your foot, you're elevating it, you're staying off your foot, and you're not expending any energy. And it's happening 24/7 for weeks. So here I go back to work, and 3 days in, with my sleep schedule, having been off my foot for 4 weeks and not expending energy, and that affects your sleep schedule, that I started to have major problems with insomnia. And so going back to work on the third day was very difficult. I almost didn't make it. It was just such little sleep, or none at all really. That actually took a little while before that started to subside. So that's temporary, but it was a big challenge, absolutely. I ended up finding out that I had sleep apnea, and I'm going to make another video series on that in the future. So I'll leave that to a future video series. That might have contributed to it, I'm sure it did. But a few months later, I was diagnosed with that. I started treating that. And again, I'll talk about that in a future video series and my experience with that. And that's been a game changer. So what happened next was started to just find some normalcy, after my bout with insomnia, whichever lasted a few days, maybe a few weeks or so. Eventually, going back to work helps, of course, because you start to get on somewhat of a normal schedule, which you want. I think most people want to be on a normal schedule, going to sleep at a normal time, waking up at a normal time, and doing physical activity, walking, driving, all the normal things that you would in life. So things did start to normalize with the sleep. I would ice it at work sometimes. Luckily, there was an ice machine there. I just took a big Ziploc bag, put ice in it, and rested my foot at it right while I was at my desk. My doctor also said if you take a 24-ounce bottle of Pepsi, one that has a very cylinder shape to it, fill it with water, put it in the freezer, frozen, and then roll your foot on it, the one that you had the surgery on. And that's good for it too, because you're freezing it, but you're getting that nice rolling motion. too, so slightly kind of a massage type of feeling to it. I definitely still had bouts with nerve pain and discomfort in the foot, on and off, that were more severe a month after, but gradually improved. So that's the important part, that it did eventually improve. I think about a month after going to work, or about 6 weeks after going to work, I ended up flying to Florida for a vacation for a week, and I was concerned about that. How's the flight going to be? How's the vacation going to be? I just had surgery. And it went really well, so I was so happy about that. I was able to walk on the beach and go to do the things you would on a vacation, enjoy yourself, relax, go to the park, and go to, really went well, and I was so happy about that. You just have to get used to what I would call the new normal. And what that means is you had this Morton's neuroma for possibly years. Then you get it fixed and have the Morton's neuroma surgery. And now your foot is different. You don't remember what it used to be without it. And now that it's gone, you have to sort of relearn what your new normal is. It changes your life. It changes the way you walk a little bit. It changes the way you feel in your foot. Remember that feeling of a ball on the bottom of your foot? Well, that is gone, which is good. But you spent 5 years with that, or more, with that feeling on your foot. And you gradually became used to that. That was your normal feeling. So you have to get used to what I call your new normal as you walk around and as you use your foot. And your body will tell you if you're going a little too far, or if you've done something that it didn't like, that you need to back off, or you need to rest, or you need to get some ice. One thing I'm doing still today, up to this day, and all through summer, several months after the surgery, I would walk every day. Walk every day for a good half hour if you can, as much as you can. Get motion, get moving, get on your foot, and just walk. You don't have to run, you don't have to jog, just walk. Some of you out there are the runners and joggers, and maybe that's what you do. But if you're not, and you're, then I think just walking, just using it, is a good thing. I find it to be very good to get out of my chair, to get outside, and just to walk around and not think about it. I go long stretches of time these days without thinking about it at all. But you're going to have your ups and downs. So actually just a week or two ago, I had a flare-up, and it started to feel like there was some discomfort there, some nerve kind of discomfort. And I called up my doctor, and he prescribed me the gabapentin, which is a nerve medication. It's a small dosage, it's 100 milligrams. And it worked. It went away. Actually, just one pill. He gave me 30 days and just said, take it 30 days and give me a call. I took one pill, and a day later, I felt like I didn't need any more. And by the way, a little side note, I also have RLS, which is restless leg syndrome. You'll find that you might find, but I found that the gabapentin helps with that too. And it makes you feel like I don't need to do that restless leg syndrome where you're moving your feet or legs. It feels like you're constantly shaking your legs, even though I'm not nervous, or I'm not in any kind of panic or any anxiety, or it looks bad, but it's for people suffering from that. You may or may not know. I'm a pretty happy, normal guy, I just happen to have this RLS. I think I've had it for decades, and the gabapentin actually improves that. I'm back in Florida right now for the second time this year. Hooray me. That's not that important, but the only reason I bring it up is because this is the second time I've gone on a flight after my surgery, and both times I didn't have a problem. Because getting on a flight after a surgery, who knows what's going to happen? Is it going to be okay? Are we going to have issues? I'm happy to report I didn't have any issues. So you're going to have your ups and downs, but kind of like the stock market, as time goes by, you're going to have more ups. Okay? Of course, stay tuned with your doctors. Let them know how you're feeling. Let them know what your recovery is. If you need to change your routine, or if you feel you need to change your routine in any way, or you're having trouble in any way, contact your doctor. Go and see them and find out, what can we do for whatever trouble you're having. But I feel like today is the best I've ever felt with my foot, and tomorrow will probably be better. And I've gone through the vast majority of the healing at this point. I had that one setback a few weeks ago. I don't know what caused it. I don't know if it was walking too much, standing too much. It's a busy time of year with the holidays. I'm sitting too much. Who knows? What caused it? I don't know. But it happened. There was a flare-up, and we took care of it. And it was temporary. It was fixable. And hopefully you don't have one. But if you do, don't worry. Just call your doctor and get a game plan going. I'm happy if you folks, send me messages and questions and things like that. I'm obviously very open about this and want to help people, and always keep a positive mind too. Mentally, try to think positive. This is going to work itself out, as so long as you do everything that your doctor's telling you to do. And whenever you have a setback, if you do, tell your doctor. Keep working with them. Comply. Use the shoe if they said. Get on the medications they ask you to. See the doctors when you're supposed to with the follow-up visits. If you have problems, call them, let them know. But this does get better, and this does improve. Remember, muscles, bones, and skin, that's predictable. Doctors can predict how many days, months, and weeks it's going to take for those tissues to get better. Nerves are not. Nerves are not predictable. Okay? So you have to be patient, and you have to, don't go out there reading the horror stories that these people, the surgery didn't work, or the neuroma came back, and this and that. At least right now, not right now. I think that's a small percentage of folks who end up having a problem. It's a very small percentage of people that have that problem. Very small percentage of people who end up having 2 neuromas in one foot. And your mind can think that when you're having a setback, well, maybe I got 2 neuromas, or maybe my surgery was bad, or it's coming back. That's not necessarily the case. Again, let your doctor know what you're dealing with, and let them resolve it. And that's where I'm pretty much going to end this. Obviously, a little longer video. I wanted to update you where I am now. I'm very happy where I am now, although it was a very difficult procedure to get through. I mean, out of all the things I've had to deal with, surgery-wise, this is by far, I've had my tonsils removed when I was a kid. I had bilateral carpal tunnel syndrome, carpal tunnel surgery, bilateral carpal tunnel surgery, both hands. I have videos on those. Those went very well. Much easier recovery on those. But this is more work, and this is more serious. But it's not heart surgery. It's not brain surgery. So I don't want to compare it to those ever. But it definitely takes more time, more effort, more patience, more work. And that requires more mental stability on your part, to be positive, stick with it, stay with the game plan, and you'll get through this, okay? All right. Thanks for watching.